Welcome to Neuromyofascial Science Today, the podcast where Dr. Lamb and I, Patrick Wagner, bring you the latest updates, news, patient stories, and groundbreaking learnings in the field of neuromyofascial science. In today's episode, we're laying the foundation for understanding some of Dr. Lamb's pioneering work over the last 30 years. We'll explore the fascinating world of dry needling and its various forms, examine the intricacies of neuromyofascial pain and pathology, and uncover the innovative treatments for complex neuromuscular conditions such as post-concussion syndrome. Join us as Dr. Lamb shares his expertise and insights that have transformed the lives of many patients. Stay tuned for an enlightening and insightful conversation that will deepen your understanding of these cutting-edge medical treatments. Dr. Lamb, many regard you as a pioneer in the field of neuromodulation. Can you elaborate on what neuromodulation entails and why your contributions are considered foundational to this field?
Certainly, Patrick. Neuromodulation refers to the therapeutic alteration of nerve activity through targeted delivery of electrical stimulation or chemical agents to specific neurological sites. This approach aims to alleviate pain, improve function, or both. My work in neuromodulation, particularly involving the use of botulism toxins, has been groundbreaking. In 2002, I patented a series of innovative treatments that leverage these toxins, combined with other techniques, to achieve chemical decompression and provide tissue remodeling around the spine. This approach has proven effective in treating chronic spinal issues such as disc herniation, spinal stenosis, and even some paralyzing injuries by addressing the underlying neuromyofascial imbalances. These treatments have opened new pathways for recovery that were not available before. The uniqueness of this method lies in its ability to potentially improve conditions at any spinal location, providing a versatile solution for a variety of complex spinal problems.
Dr. Lamb, can you explain the concept of dry needling and differentiate between its various forms, particularly in terms of their application and efficacy?
Absolutely, Patrick. Dry needling involves the insertion of a fine needle into soft tissue to induce a therapeutic response. This technique aims to normalize the tissue's electrical and mechanical functions. Traditional acupuncture is a foundational form of dry needling, boasting over 4,000 years of history and demonstrating remarkable effectiveness. In contemporary practice, we often see rehabilitation-style dry needling employed by physiotherapists and chiropractors. This method targets muscle trigger points to alleviate tightness and enhance muscle function. However, advanced dry needling, or ADN, represents a significant evolution in this field. ADN integrates sophisticated electromechanical techniques to address complex musculoskeletal and neurological issues. By focusing on the muscles and the fascia surrounding the spine and limbs, advanced dry needling, or ADN, facilitates recovery from intricate pain disorders and disabilities, conditions such as chronic migraines, various types of arthritis, complex tendinitis, and syndromes like post-concussion syndrome and fibromyalgia benefit greatly from these advanced techniques.
Dr. Lamb, could you elaborate on the concept of neuromyofascial pain and pathology and its implications for the diagnosis and treatment of musculoskeletal disorders?
Certainly, Patrick. Neuromyofascial pain and pathology involve the intricate study of how muscles, fascia, and other soft tissues impact the spine, nervous system, and overall musculoskeletal framework, leading to various pain syndromes and disorders. This field of science seeks to understand the complex interplay between these elements and how they contribute to both acute and chronic conditions. Common manifestations include chronic tendinitis, headaches, migraines, and joint pain. However, more complex conditions such as fibromyalgia, post-concussion syndrome, and chronic neck and back pain are also rooted in neuromyofascial pathology. Additionally, repetitive strain injuries and certain neuromuscular disorders, including multiple sclerosis, exhibit components of neuromyofascial dysfunction. Understanding these connections allows us to develop targeted therapeutic strategies that can address the root causes of pain and disability.
Dr. Lamb, your approach to treating complex neuromuscular conditions, such as a post-concussion syndrome, PCS, is known to be quite unique and effective. Could you elaborate on how your methodology differs from traditional treatments and what makes it so effective?
Certainly, Patrick. To begin with, I prefer the term spinal concussion syndrome over post-concussion syndrome, as it is more accurately reflecting the underlying origins of many PCS symptoms. I believe and have demonstrated that common symptoms such as headache, tinnitus, vertigo, light and sound sensitivity, jaw pain, and cognitive complaints have spinal origins, often driving these symptoms. My approach involves symptom-specific site care, targeting and treating each symptom individually in those suffering from PCS and other neuromuscular conditions. This method might seem counterintuitive because PCS is typically seen as primarily related to a brain injury. However, medical evidence suggests that PCS symptoms are often not directly correlated with the severity of the head trauma. Instead, they relate more to the linear acceleration of the head and neck during the injury. This perspective helps explain why brain MRIs in PCS patients are often normal and why symptoms may be delayed, mimicking a spinal injury timeline more closely than a brain injury.
Dr. Lamb, building on our previous discussions, how can a spinal injury from a whiplash event affect the brain and lead to long-term issues such as post-concussion syndrome?
While large-scale clinical studies have yet to conclusively prove this point, my observations suggest a phenomenon I call soft tissue tethering of the spinal cord. This occurs within the neck or thoracic spine and causes recurring traction injuries that affect the brain and its functions. This spinal concussion traction could explain why we see chronic traumatic encephalopathy in individuals with long-term post-concussion syndrome, or PCS, resulting from gradual progressive brain traction injuries. Additionally, this mechanism might explain some of the pituitary injuries we also see in PCS. The traction from the thoracic spine and neck can literally pull the pituitary gland towards the skull's floor. It might also shed light on why individuals with chronic PCS exhibit retinal thinning, as shown on optical coherence tomography or OCT testing. Similar retinal thinning is observed in other neuromuscular conditions. Through addressing the specific components driving each symptom, such as headaches, jaw pain, tinnitus, vertigo, limb weakness, and visual deficits, I've seen significant recoveries in post-concussion symptom patients. This involves targeting where I believe the spinal cord or associated nerve roots are entrapped, thereby alleviating the individual's deficits reported by those living with PCS.
Dr. Lamb, spinal traction from soft tissue tethering might explain many PCS symptoms. How does this relate to the changes in brain blood flow seen on special MRI SPECT scans?
This phenomenon isn't fully validated in large clinical studies yet, but here's my perspective. The blood flow changes observed on SPECT scans seem to originate from outside the brain, suggesting a cervical vascular compromise. Severe whiplash trauma, combined with spinal cord tethering, seems to trigger severe spasms in the neck and thoracic spinal muscles, a condition I refer to as static cervical thoracic dystonia. These dystonic muscles can alter blood flow in the carotid arteries by exerting direct pressure in certain neck positions. I have observed this in patients during active ultrasound assessments with neck movement, where we were able to detect significant changes in blood supply. For instance, during these assessments, we could see the blood flow to the brain diminish significantly on one side, particularly when there was severe contractures in the neck muscles, such as the right sternocleidomastoid muscle. This kind of dynamic assessment clearly demonstrates how muscle spasms and contractures can impact vascular flow to the brain.
Thank you for joining us on Neuromyofascial Science Today. Today, we've laid a crucial foundation in understanding the innovative techniques and profound impacts of Dr. Lamb's work in neuromyofascial science over the past 30 years. From exploring the effectiveness of dry needling to discussing the complexities of neuromyofascial pain and pathology, we've seen how Dr. Lamb's approach continues to advance the field and transform patient lives. We hope this episode has provided valuable insight and inspiration. For more information, visit our website at nmfscience.com and make sure to follow us on all your favorite podcast platforms. Stay tuned for more incredible stories of healing and transformation.